Hai, kia ora no tātou katoa. Nā, ki tētahi atu take e pāna ki te tika. E hia miriona tāra kei te whakapaua e te kāwanatanga ki roto i te kōti, kia takahuri ai i a rātou te whakatau e meana, me whai utu ngā whānau o te hunga hauā, mo te tiaki i era o rātou e hauā ana. He whawhai tēnei e wero kikini ana i te ngākau Māori me ona whakaaro hui a kai manawa ki tēnei mea ki te whanaungatanga. Me te aha, koe rā hoki tā Carmen Parahi i rongo ai.
Dr. Huhana Hickey may be New Zealand's staunchest disabilities lawyer, but her multiple sclerosis means she also needs help just for basic care.
And so this is your daily job, is to help your mum?
Pretty much, yeah. Either getting in and out of the chair here or when we're travelling.
And so it's just this physical work that your mum needs help with?
That's it. She can't get the chair out herself.
Yeah.
Yeah, with the ramps and with the hoist.
Under the Ministry of Health funding criteria, he is not allowed to live with me and be paid as a caregiver. He can only be paid as a caregiver if he does not live at home. Now, my son has to travel to come and do his care for me because he lives in Hamilton. And he has got to travel and do that because I insisted I need him because he knows me and he knows me better than anybody else. Now, that's going to change soon and I have to find somebody else.
Next month I'm going to be studying, so that'll make it a bit harder on Mum because I'll help when I can, but I'll be moving up here, so I can't keep working for her and she's going to have to bring a stranger in and I can't do full-time care for her that way.
So how does that make you feel?
It sort of disappoints me. I can't help her like I want to be able to. Yeah, I can't do half the things she needs help with.
Come on, let's go. Thanks, Jay.
There are two disabilities funding regimes in New Zealand. ACC fully funds families to look after their own, but the Ministry of Health doesn't.
Now put some of the berries in. Yep, loads more and more.
The Ministry of Health has classified Huhana as an individualised funder, allowing her to pay her son for 28 hours care, but he's not allowed to live with Huhana or work during the weekend.
Here you go.
Thanks, hon. But for the causation of what creates your disability or your impairment, we would be under a different regime of funding. But for the fact that I've received a medical type of impairment puts me under a form of disparity, a form of inequality, a form of inequity compared to those who have accidents.
As well as the individualised funders scheme, families are offered a DPB carer support benefit of $1.50 an hour to stay at home and care for severely disabled family members.
Go and get it, good boy, that's it.
Huhana says government support for families with disabilities has gone to the dogs.
Hello. The choices become really limited. You either accept the DPP carer support, and you'll find whānau can sometimes be whakama and proud, and they're saying we don't take that, we don't do welfare, you know, and that's all fine and dandy, but how are you surviving? Or they go without and they're suffering because they don't know what they're entitled to. They become part of the deprivation.
But there are some families who aren't whakama, shy or embarrassed about the hardships they're facing. They've legally challenged the Ministry of Health over their policy not to pay families to look after their own with special needs. The Human Rights Tribunal and the High Court found the policy discriminates against families. But the Ministry of Health has taken the decision to the Court of Appeal. They refuse to answer our questions about their policy.
Dr. Huhana Hickey represents persons with disabilities here and in the United Nations. We joined her at South Auckland's Wātea Marae during a public health campaign, where she told us the government's reluctance to change its policy will affect our international human rights credibility.
Discriminates. pure and simple. Both, I think, in the area of international law, in the area of the fact that New Zealand has signed and ratified not only the Convention on the Rights of Persons with Disabilities, but more significantly for Māori disabled is the Declaration on the Rights of Indigenous Peoples, Article 22, and the Treaty of Waitangi.
Huhana is warning all to be aware of the government's funding regime. 1 in 4 New Zealanders will have a health disability requiring care at least once during their lifetime, and it's their families who will inevitably have to provide the care.
ACC allow whānau to be caregivers, and so whānau are left, right and centre, but Ministry of Health disabled are not allowed to have whānau as caregivers or paid, and that's the difference, and it's just ridiculous.
Wayne Te Rangi and Dane Tifa were both paralysed in accidents. Their expenses are fully covered by ACC, and they can choose to have family members as paid caregivers.
Yeah, you have other people who are in the same situation as we are, who are medically disabled and the same level as us, and yet they don't get the same treatment we do from ACC.
So do you think the policy is unfair?
Very.
Yeah, I think
very.
It is, yeah.
Because we're all in the same boat at the end of the day.
How can, like if you're disabled like us, you're disabled, doesn't matter when you got disabled or how you got disabled, the condition is still the same.
The Ministry of Health budget is $2.5 to $2.8 billion a year. $840 million is spent on disabilities services for 30,000 disabled persons. The ministry argues it would cost up to $593 million to reverse its policy. But the Human Rights Tribunal and High Court didn't buy into the argument when it was presented in court. And neither is disabilities advocate Tania Kingi. She says it doesn't make economic sense to keep pouring money into institutional care instead of families.
There are other people who believe that whānau shouldn't be paid for looking after their own. I guess I agree with that to a point, but for so many decades now, governments of this country have been ploughing resources into institutions so that whānau are disenfranchised from providing care for their own.
Shake, shake, shake. Good boy.
Now we're at a point where the country simply can't afford to keep paying for institutions or care agencies and are now relying on whānau to look after their own. What has to happen is that the capacity of whānau to do that, to take that obligation back, has to be resourced. So this case is a good example of where that happens, and eventually it will be far cheaper for the country to allow whānau the space to look after their own, to resource them well, to provide all sorts of educational tools and supports. And then the state institutions and service providers can play a supporting role instead of the primary role.
Dr. Huhana Hickey says the government's policy discriminates against families and stops them from being fully resourced to care for their own with disabilities. She says the issue needs to be addressed on the international stage, taken to the United Nations for their support.
I will really strongly encourage that we as New Zealand disabled and as Māori disabled as well consider taking this case through to the Special Rapporteur directly. If it doesn't work at our court system level and if our government keeps saying no, 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 then we need to take it to another level where they will basically enforce an action on New Zealand. And we're a small country and we pride ourselves in our human rights status. They're not going to want to be seen bad under the international human rights networks, that's for sure.